The Committee on Judiciary and Hawaiian Affairs call to order Thursday, February 17, 2022, 2:00 p.m. We have 4 items on the agenda today. First one is House Bill 1776, House Chair Fund relating to public safety. Vice Chair.
Yep, first up for HB 1776 HD1, we have the Department of Human Services in support. Okay, not here. Just a reminder for testifiers, a 2-minute limit out of respect for the other testifiers. Next up, we have the Department of Public Safety. Department of Public Safety in support.
Hi, good afternoon, Chair, Vice Chair, committee members, Max Latani, Department of Public Safety. We stand on our written testimony supporting the intent of this measure. Thank you.
Thank you. Next up, we have Public Defenders in support.
Hi, good afternoon. Deputy Public Defender Terrence Moss on behalf of the Office of the Public Defender. We stand on our written testimony in support of the measure.
Okay, thank you. Next up, Women's Prison Project in support.
Yes, thank you. My name is Linda Rich, and I am testifying on behalf of the Women's Prison Project. We very strongly support this bill and believe that the furlough programs make an incredible contribution to the decrease of recidivism among women. Thank you, and I'm available.
Thank you. Next up, we have YWCA of Oahu in support.
Hi, this is Jen Wilbur with YWCA Oahu. I'm testifying in strong support. We'll just stand on our written testimony.
Thank you. And last, we have ACLU of Hawaii with comments. Okay, not here. Members, we also have the Department of Budget and Finance with comments, Hawaii Substance Abuse Coalition in support, Hawaii Women Lawyers in support, and Hawaii Health and Harm Reduction Center also in support with written comments. Members, any questions? Okay, seeing none, we'll move on to HB 2312 HD1 relating to prison reform. First up, we have the Hawaii State Commission on the Status of Women with comments. Not present. Next up, Department of Public Safety with comments.
Good afternoon again, Chair, Vice Chair, committee members, Max Latani, Department of Public Safety. We again would stand on our written testimony, providing comments. Thank you.
Thank you. And last up, we have Women's Prison Project in support.
Thank you. I would like to say something about why the Women's Prison Project believes that this is such an important bill. In 2000, there was a huge conference statewide called Treat the Women, Save the Children. It was the Department of Public Safety, the judiciary, people from the National Department of Justice participated. All of the ideas that we are trying to ask you to implement were suggested in 2000. In 2019, you received a report from a task force, again, making recommendations about how to improve the treatment of women in the corrections system. Here we are in 2023. Women are a small portion of the number of people who are incarcerated in Hawaii. It's very easy because the system was designed by men for them to get lost in the shuffle. We believe that having a specific implementation commission with authority to oversee the implementation of changes is really vital for ensuring that they happen and that they happen in a gender responsive, evidence-based kind of way. Thank you, and I'm happy to take any questions.
Okay, thank you, members. We also have written comments from Department of Budget and Finance with comments, Judiciary in support, and the Hawaii Health and Harm Reduction Center in support. Members, any questions? Seeing none, we'll move on to HB 2313 HD1 relating to risk and needs assessment for female offenders. First up, we have the Department of Public Safety with comments.
Good afternoon, Chair, Vice Chair, committee members, Max Latani, Department of Public Safety again. Department would offer comments, and we recommend that this measure be held. We're offering 2 recommendations at this time. First, we would ask if the committee would allow the department to continue with our internal reorganization to address female offender assessment and treatment needs. This bill does not provide an appropriation. It's likely that the department will probably come back to seek financial support from the legislator next year to support these new initiatives. The second recommendation, and much larger, would be to utilize the previous bill, House Bill 2312, to explore assessment and treatment issues for female offenders. All treatment plans that utilize evidence-based practices start with an assessment. Similar to the Interagency Council on Intermediate Sanctions, issues such as assessments and treatment for specific offender population should be addressed system-wide for all offenders under the criminal justice system of Hawaii. Thank you for this opportunity to testify, and we'll be available for any questions you may have. Thank you.
Okay, thank you, members. We also have written comments from Hawaii Correctional System Oversight Commission in support, Hawaii Substance Abuse Coalition in support, Women's Prison Project in support, and Hawaii Health and Harm Reduction Center in support. I do notice, Linda, you're here, although
Yes.
I did not indicate that you're testifying. Would you like to say something on this matter?
I would like to say something on this matter. Thank you. I would like to say that there are already a number of assessments instruments that are gender specific that have already been developed that are being successfully used in other states. I would urge you not to delay this yet again to put the needs of women on hold. I don't believe that it would be an extensive process or a costly one to implement a evidence-based validated assessment tool when we have them already available. Thank you.
Okay, thank you, members. Any questions?
Chair, Ward here.
Yes, report.
Was that Mr. Otani who said the bill should not pass? Was that you, Mr. Otani?
Yes, I'm asking if this matter could be held to allow us for this internal organization that we're doing right now to address female offender needs. And the second recommendation is to utilize the previous bill as a means to explore assessments and treatment issues for females offenders.
Maybe I'm not up to speed. I'm not sure I understood all that. So you're reorganizing and you're doing what? Which is another reason to postpone it? I didn't get it.
Oh, we have a position within our reentry office that we're actually redescribing the position to focus on female offenders within our prison population. And once that is done, once the reorganization is done, then that person, program specialist, will be involved in researching best practices for female offender assessments as well as treatment issues.
So you're saying you're already doing this in effect then?
No.
We're in the process of reorganizing, yes.
Wait,
If-
Linda, can you mute yourself and turn off your video when you're not testifying? Thank you.
So Mr. Otani, what if we just pass it and you get some money out of it or some more credibility? Or will it cramp your style if it's passed, given what you just said?
We're not sure what the actual cost will be at this time for assessment tools, because assessment tools vary. And there's also the issue of training issues. Who will be actually applying these assessment tools?
But this one doesn't have, let me see, an amount, or does it have an amount?
There's an appropriation.
So there's no structure of incentives in terms of passing it and getting money. But is there a harm reduction if it's passed, or is it like you guys don't need it? I'm not clear on what would be wrong if it was passed, other than you guys are already doing it, or is it just replicative, duplicative, redundant?
Oh, we're not opposing it. All we're saying is that we're already starting the process of looking at female offender assessments and treatment needs. So we're not opposing it. It's based on our testimony.
So let you guys handle it rather than going into statute. Maybe
Yes.
Okay, good. Thank you very much, Mr. Otani.
Yes.
Thank you, Chair.
Okay, thank you, members. Any other questions? Yeah, Rep. Tokioka.
Sorry about Yes, so for Mr. Otani,
Yes,
I thought I heard you say the first time Rep. Ward asked you if you wanted the bill to pass, and you said you wanted it, you would prefer it be held. And then just now you said that it's if it passes, you're not opposed to it. So I mean, I was ready to vote to hold or to vote no, but if you guys don't need it because you're using the other bill, and Max, you come highly. Your credibility is really high in the system. A lot of the people that are working under you appreciate you. So when you testify on something like that, I take that very, very seriously. That you guys don't need it. That's what I thought I heard you say. So can you clarify that, please?
our testimony basically says that we're in the process of looking into these various issues for female offenders. Our second recommendation is to use the previous bill, which sets up the commission to look at offenders, female offenders as a whole, to address treatment and assessment issues. And that bill has some money in it. So we could use, if this bill and the next bill is held, we could use that bill as a means to explore treatment and assessment options for females.
Members, any other questions? Okay, seeing none, we'll move on to HB 1778 HD1 relating to the Comprehensive Offender Reentry System. First up, Department of Public Safety and Support.
Hi, good afternoon again. I'm Max Otani, Department of Public Safety. We'll stand on our written testimony and our previous verbal testimony. It's synonymous to this bill. Thank you.
Okay, thank you. Next up, we have the Hawaii Correctional System Oversight Commission in support. Okay, not present. Last, we have Women's Prison Project in support.
As noted in my written testimony, research over many years in many states has identified that women's pathway to crime are different than those for men. It also notes that women are often classified in terms of their risk, and also there's a mismatch between their needs and programs when there is not a gender responsive assessment done. We also hope that an assessment done pre-trial will help to reduce the incarceration of women in Hawaii, since our state has women as the highest percentage in its incarcerated population of any state in the nation. We believe, as do many researchers and many successful programs around the country, that there are many women who end up in prison who could be successfully rehabilitated in community-based programs with supervision from the court. Thank you.
Okay, thank you. Members, we also have written testimony from the Hawaii Substance Abuse Coalition in support, the Hawaii Health and Harm Reduction Center in support, and the YWCA of Oahu in opposition. Members, any questions? Rep. Kobayashi.
I just want to point out that it looks like the testimony from YWCA is actually in support. It's listed as an opposition. I wonder if that could be clarified.
Yeah, I saw the same thing.
They may have clicked the wrong box when they were submitting it. Members, any further questions?
Chair, I have a question to
Forward.
Linda Rich. Linda, you're going away? I'll ask Mr. Otani.
I'm
you're
not
still
going
there.
away. I'm still here.
I was rather amazed when you said the women in Hawaii are the most incarcerated in the nation. Is that always been the case, or that's like recent, or I'm just not in the know of what's going on?
Well, let me clarify what I said. When you look at the prison population in Hawaii, we have the highest percentage of women in that population of any state in the nation. And yes, that has been true for a number of years.
What is the percentage actually?
I don't remember the exact percentage, but I can get you that information.
55 point. And really, the one that I'm most interested in, and this is the broken record that I always ask you or Mr. Otani, what is the women's recidivism rate versus the men's recidivism rate in the state of Hawaii? To me, that's the gold standard of whether we're effective or ineffective, no matter what we're doing, what commissions, what studies, whatever.
Well, I can tell you that according to the Hawaii Judiciary's Criminal Justice Research Institute, the latest data they were able to give us was from 2018, and the recidivism rate for women at that time was 51.5%.
So that is, Mr. Otani, like 20 points less than men? Or wait, sorry, one of your colleagues said it was 59%. Did Mr. Otani, you still there?
Yes, I am.
Is the male recidivism rate broken down to where it's 59 or 60%, or is it where you have women and men all prisoner recidivism in your number?
I think it's a combination, sir.
Okay, so we can't actually measure it very accurately. Or Linda, do you have the number of what would be men? If you got women, I would say
I don't have the men's number, but I can tell you, I'm sorry, 51.3% was the rate for women, according to the Criminal Justice Research Institute as of 2018. We were not able to get data for this year. The other thing I can tell you is that in Los Angeles, we looked at a program that was moving women who were nonviolent, low-risk offenders whose issues were primarily around drug abuse, mental health, trauma, into community-based programs with court supervision, and they reduced the recidivism rate of that group to 18%. So to me, this just makes sense. We want to incarcerate fewer women, and we want to reduce the recidivism rate. And there are proven ways to make that happen.
Well, that's music to my,
yeah.
It's music to my ears, because it doesn't seem like we have done that. I always compare it to if you went to the doctor 50% of the time and you wouldn't get healed, you'd stop going.
Let's stick with questions. If you want to comment on the bill, we can do that after, as we're just doing decision making.
Well,
do you have any further questions, report?
No, that's it. Thank you.
Yeah, thank you. Members, any other questions?
I have a quick question, real quick. If you don't mind, Vice Chair. Thank you, Linda, for your testimony and everything. This is a product. These bills, I mean, collectively are the product of a working group, are they not? That has, that was commissioned to do a study to actually reach out to stakeholders to work with, and so I mean, this is kind of effectuating these reports to us, this product, instead of letting it sit and collect dust on the shelf, right? I mean, that's what to me is exciting about all the bills collectively as a whole. I know we're speaking on this one in particular, but it's because that's where it came from, and it's effectuating something that had a lot of thorough input from many areas. I mean, is that something you think that has been important in helping to create these bills and move them forward?
Yes, we did look at the data from the Judiciary's Criminal Justice Research Institute. We looked at the report from the resolution that came from this House, the report that was so thoroughly researched and so carefully put together by experts, not only from Hawaii, but outside of Hawaii, making recommendations. The Women's Prison Project itself is an ad hoc group of women who care deeply about the treatment of women within the correction system. We went back and looked at these documents and saw Chapter 10 of that resolutions report says very clearly what the recommendations are. We don't want this to just sit on a shelf somewhere. It's very important, I think, to the women, their children, and to our community to reduce the incarceration of women, and for those who are incarcerated to ensure that they move back into the community in a way where they are healthy and prospering and our community is safer.
Thank you so much. Thank you, Chair.
Thank you. Members, any other questions? All right, seeing none, we will recess for decision making.
Okay, reconvening the hearing of the Committee on Judiciary and Hawaiian Affairs. So, Thursday, February 17, 2022. Reconvene for decision making. House Bill 1776 related to public safety. The chair's recommendation is adopting the proposed amendments from the ACLU, encouraging community-based workflow and re-entry. Members, any questions or comments? Seeing none, Vice Chair as amended.
Yep. Chair's recommendation is to pass HB 1776 HD1 with amendments. Chair and Vice Chair vote aye. Rep. Ichiyama.
Aye.
Rep. Kobayashi.
Aye.
Rep. Lopresti.
Aye.
Rep. Lowe.
Aye.
Rep. McKelvey.
Aye.
Rep. Nakamura.
Aye.
Rep. Takumi.
Aye.
Rep. Tokioka.
Aye.
Rep. Ward.
Aye.
Chair, your recommendation is adopted.
Thank you very much. HB 2312, House Draft 1 related to prison reform. The chair's recommendation is that we pass this out as is. Members, any questions or comments? Seeing none, Vice Chair as is.
Chair's recommendation is to pass HB 2312 HD1 as is, knowing the presence of all members. Any members voting with reservations? Any members voting no? Chair, your recommendation is adopted.
Okay, thank you very much. House Bill 2313, House Draft 1, related to risk and means assessment for female offenders. Chair is cognizant of the concern presented by Director of Public Safety. However, I think the discussion is one that I would like to keep alive, at least to finance. And so I recommend passing this out as is. Members, questions or comments?
I have a short comment, Chair. Based on the testimony of Mr. Otani, and I know he's not in opposition, but I think as someone as new as the director is, he's doing a great job. We'd like to, give him the ability to do the work. And the other bill has money, this one doesn't. So for that reasons, I'm going to be voting no, Chair.
Okay, thank you very much. Members, any other questions or comments? Okay, seeing none, Vice Chair as amended, as is, I'm sorry.
Chair's recommendation is to pass HB 2313 HD1 as is, noting the presence of all members. Any members voting with reservations? Rep. Ward with reservations. Any other members voting with reservations? Noting the no vote of Rep. Tokioka. Any other members voting no? Chair, your recommendation is adopted.
Okay, thank you very much. And House Bill 1778, House Draft 1 related to the Comprehensive Offender Reentry Program. Chair is informed that the bill has already passed out of WAM, so it will be headed our way. So we will defer this measure. Okay, thank you very much, members. We are adjourned.